Your child recently had a G or GJ tube inserted in the image-guided therapy department at SickKids. This video is going to help you understand why your child has a dressing on their G or GJ tube, when to change your child's dressing, how to change your child's dressing and securement device, how to cut the retention suture and tape the tube after the dressing comes off, how to take care of the skin. Your child needs a dressing on their G or GJ tube in the first 2 weeks because it is very important that the tube does not move and that the retention suture is not pulled out. In the first 2 weeks, the tract or tunnel from the outside of the body to the inside of the stomach needs to heal. If the tube moves around in the tract, it can prevent healing. If the tube is accidentally pulled out during this time, there is a higher risk of peritonitis. Peritonitis is a very serious medical concern that can lead to infection spreading throughout the rest of the body. We want to avoid this, so making sure the tube is well secured to the tummy in those first 2 weeks is extremely important. This is what you will see on your child's tummy after he or she has had their tube inserted, a stat lock. This is used to make sure the tube does not move during the first 2 weeks after it is inserted. It sticks to your child's skin and snaps the tube into place. A dressing. This clear dressing on top of the stoma is called a Tegaderm IV Advanced. It is a breathable dressing that allows you to see the skin at all times, but also keeps the tube from moving in and out of the stoma. Retention suture. The retention suture is inserted by the radiologist when they insert the tube. It helps the stomach heal into the position needed for tube feeding. You will see a little gauze package with a string wrapped around it on the outside, under the tube. The rest of the string is in the tract. At the end of the suture is a metal T-piece. The retention suture should never be pulled since the T-piece can get stuck in the tract. The retention suture stays in place for 14 days. The stat lock will stay in place for 14 days unless it becomes dirty, wet, or falls off on its own, or if there are skin issues such as skin breakdown, redness, or rash underneath it. If this happens, you will replace it with the grip lock you were sent home with. The clear dressing will stay on for 14 days, being changed only once at day 7, unless it becomes dirty, wet, or falls off on its own. You will be given extra dressings when you leave the hospital. It is important to look at the skin under the dressing every day. If there is increasing redness, pain, fever, discharge, or swelling, please contact the G-Tube resource nurse for help. On day 7, it is time to change the dressing. You will remove the clear dressing, clean the skin with soap and water, and reapply the new dressing. The stat lock does not get changed at this time. Here are the steps for changing your child's dressing. Gather all your supplies. You will need a washcloth, warm water, soap, and a new Tegaderm IV Advanced or clear dressing. Wash your hands. Prepare the washcloth with warm water and soap. A good trick is to use half of your washcloth for the warm water, soap on one side, no soap on the other side, and then keep the other half dry. Remove your child's clear dressing. Pull gently at the corners of the dressing until it starts to lift off. Be careful not to pull the tube or the retention suture during this time. Gently move the retention suture package out of the way and wash your child's stoma with soap and water. Rinse with the non-soapy water and pat dry. Gently put the retention suture back under the tube and reapply the clear dressing. Use the extra strip of tape that comes with the clear dressing to secure the tube further. Throw out your used supplies and wash your hands. If your child's stat lock needs to be changed, you will replace it with the grip lock that you were sent home with. When removing the stat lock, the dressing must always be in place to prevent the tube from moving. Here are the steps for this. Gather all your supplies. You will need a washcloth, warm water, soap, a grip lock, and an alcohol swab. Wash your hands. Prepare the washcloth with warm water and soap. A good trick is to use half of your washcloth for the warm water, soap on one side, non-soap on the other side, and then keep the other half dry. Open the clamp that holds the tube in place by pushing the button on the side. The top will pop open and you can gently remove the tube. Remove the entire Statlock from the skin using the alcohol swab. Wash your child's skin with soap and water. Rinse it with the non-soapy water, then pat dry. Reapply the grip lock in the same area where the Statlock was. The grip lock has a Velcro piece that you will lift up to place the tube in the correct spot. Once the tube is in place, you will secure the Velcro. Throw out your used supplies and wash your hands. Now that the first 2 weeks are over, your child no longer needs the dressing and retention suture. You're going to remove the dressing and Statlock, as well as cut the retention suture. Starting now, you will also secure the tube with tape. Wash the stoma with soap and water and rotate the tube's position every day. Here is how you will care for the stoma after day 14. Wash your hands. Remove your child's Statlock or grip lock. Remove your child's dressing. Cut the retention suture. To do this, gently lift the retention suture away from the skin and cut the string as close as possible to the stoma. Throw away the gauze package. The small amount of string that is left will get pulled into the stomach and passed in your child's stool. Clean the stoma with soap and water. Rotate the tube. If you pretend the stoma is a clock, you will rotate the tube by 3 hours every day. For example, you will go from 12 o'clock to 3 o'clock, then 3 o'clock to 6 o'clock. For G-tubes, you can rotate all the way around the stoma, 360 degrees. For GJ tubes, you should only rotate halfway around the stoma, 180 degrees. Secure the tube to the skin using a strong tape. At Sick Kids, we use Hypafix tape. You want the stoma to be open to the air. Taping the tube 1 centimeter or 1 finger width from the stoma will help keep it open and prevent the tube from moving around a lot in the stoma. Every day, you will wash the stoma, rotate the position of the tube, and tape the tube to the skin. If you have any questions or concerns about how to take care of your child's tube or skin, please do not hesitate to contact the G-Tube resource nurse for help.